Hi, welcome everyone. I am so glad that you are able to join us today for our webinar. So today I am going to talk about a highly requested topic, and that is how to use our syringes properly. I know it can be pretty confusing and things might change from needle to needle that you're using, but today we are specifically talking about the needles that you would be getting in your package. And disclaimer again, please talk to your doctor or reach out to your dispensing pharmacy or pharmacist if you have any specific questions. Because I'm not physically there with you, it's hard to answer any specific questions. And this webinar is intended to deliver best practice information on injecting subcutaneously, but not intended to replace medical advice provided by your doctor or your pharmacy. And then lastly, I will do my best to go over these general best practices so that you can get the most out of your medication. All right, let's begin. And again, I am happy to have you here today. All right, perfect. So if you didn't make our first webinar, I highly encourage you go back and watch it because we went over a lot of great steps to support you on your health journey. But if you didn't make that, I did want to just take a quick second to introduce myself. I am Dr. Stephanie Chan. I am a pharmacist with a background in both traditional and functional medicine. My role here at Brello is to support you on your health journey every step of the way, and it could look different, just however you need me to show up. Today, I'll be walking you through how to properly use a syringe, whether you're administering medication at home, preparing a supplement perhaps, or even supporting a loved one in using needles. Now, my goal here is to make this feel safe, simple, and stress-free, so that by the end of this, you'll feel confident handling a syringe correctly, understanding dose accuracy, and avoiding very common mistakes. So let's get started. All right. So today, this is what we will be covering. We will be essentially going over syringe basics and techniques, medication storage tips, injection best practices, common issues, and frequently asked questions. And then we'll do a live Q&A at the end. We will also address any questions at the end. And here is a QR code that you can scan. Please, we will leave it up throughout the whole presentation so that you have time as questions come up to insert your questions. And then at the end, we'll try to get through as many as possible. And we are excited to hear your questions. The more interactive this is, the more valuable I think it will be as well. All right, let's carry on. Okay. Perfect. So why does this matter? Why is it important to have proper injection technique? And it's essentially just to help you maximize your medication use. It improves adherence to the medication. It minimizes discomfort or irritation. It reduces the risk of waste errors, and it helps you stay confident in your routine. The more, pain or irritation you have when you're using wrong technique, the more unlikely you will continue the medication. So here, I don't know if you guys have it in front of you as well. This is basically syringe 101. So basically this is like the anatomy of a syringe, essentially, a subcutaneous syringe. So here's the cap. When you remove it, that is a short subcutaneous needle. The barrel is where the medication goes, and when you pull it up, and then as well as the plunger is where you pull back to draw up the medication. All right, so where to inject? As we mentioned in the previous slide, we are highlighting how to use a subcutaneous needle. So it's important to pick injection sites that can help you get medications administered through this route. Just brief overview, subcutaneous actually means under the skin. So specifically the fatty tissue layer that's between the skin and the muscle. Now this layer just has fewer blood vessels. So medication injected here is known to absorb a bit more slowly, and it gets released a little bit more steadily into your bloodstream. Some medications are designed to work gradually over time, which makes subcutaneous tissue the perfect spot. It also allows for a controlled release of the medication rather than a rapid spike that you would expect from like an IV or intravenous site. The good news is that subcutaneous injections are typically less painful. It's easy to learn and something you can absolutely feel confident doing at home once you know the basics. So, two sites that we, really like for subcutaneous injection is the abdomen area. We recommend typically 2 inches around your belly button. So, 2 inches away from the belly button all across. And then also the thigh, the upper area. These are just common areas that we typically carry a little bit more fatty tissue, so it would be easy to inject as well. And you have like a clear visual of it, and both hands can be free for those sites. All right. So, really quickly, these are kind of like the steps for best practices on how to um, um, inject with the subcutaneous. So, first of all, you always want to make sure you're washing your hands and cleaning the injection sites. So, you should have also received some alcohol pads with your package. So, make sure you are cleaning where you intend to inject pretty good. You want to draw up the appropriate dose by removing the cap and also using an alcohol swab to wipe the top. All you really need to do is one swipe movement. You don't need to go in circles or kind of sometimes the alcohol pads could be pretty saturated. You don't want any like alcohol swimming on top. You just need one wipe over the top, and then you insert the needle in and draw up the dose that you need. Afterwards, if we're doing the abdomen, if you look at picture number 3 over here, if you're looking at the abdomen, you're going to pinch that site. It just kind of helps um, concentrate the fatty tissue, also kind of draws away from the pain as well. And then you're going to insert the needle at a 45-degree angle and push the plunger slowly. Going slowly can really help with the pain tolerant, like the pain of the injection as well. It is a fairly thin needle, so sometimes you might not even feel it, but injecting your dose rather slowly can be one of those tips. And then you want to remove and dispose the needle safely. So sometimes recapping, you don't have to recap before you dispose. If you don't have a sharps container at home, you can always kind of DIY one yourself, or just find a container at home that has a very sturdy plastic outside. So if you have like an old, like a laundry detergent bottle or anything like that where the needle can't penetrate, you want to just fill it up. Just throw the needle in there after each use. And then make sure you are correctly labeling it sharps container so everyone around the household knows. Keep it away from children if there are children in your house, and make sure it is tightly sealed as well. Um, Definitely go over your local guidelines on how to dispose of the needles safely, but as long as it's kind of sealed properly and tightly. After it's 3/4 of the way filled, you could dispose it in your trash, but definitely look up your local guidelines as well. You can also find actual sharps containers at your local pharmacy, but those are just some tips for you for disposing it safely. All right, so here are some tips. We always recommend rotating the injection site so you're not constantly poking one area. That's just gonna, the more you poke one area, the more irritation it's gonna cause. So if you're doing your abdomen one day, you could start at the top of the abdomen and then go to the bottom of the abdomen, and then maybe even the upper thigh another like a day or a week that you need your medication. But rotating the site always helps. Um, like I mentioned before, you don't want that alcohol to pool on top of your medication bottle, as well as you don't want the alcohol to still be wet on your injection site. So allow it to dry so there's no like stinging. We all know that alcohol can sting if we are like puncturing our skin. Temperature suggestions. So we always most injectable medications need to be stored in the fridge. That just helps sustain the medication from denaturing, from breaking down, and from things from growing inside. Now, when we're taking it freshly out of the fridge, I understand that it could be pretty uncomfortable to kind of inject a cold solution into our skin. So if you want to let it sit out for maybe 10, 15 minutes to even bring it to closer to room temperature, that is an option as well. We do recommend, right after you draw up your dose to put it back into the refrigerator as fast as possible to kind of keep the integrity of the medication. But if the cold medication bothers you, that is an option that you could do. And like I mentioned before, you want to go slow to kind of reduce the sting if you are having any issues in that end as well. All right. Now, medication storage. So, best practices, again, like I mentioned before, keep it in the refrigerator. Um, if especially in the summertime, if there are power outages, depending on how long your power is going to be out, try to keep it in the back of your fridge so it does stay cool. If you have ice packs, to kind of keep the medication cool, I would put that in a cooler as well. Anything you could do to kind of keep the medication for as cool as long as possible. We don't want you to freeze it, so don't stick this in the freezer. Store in the original container if that is an option for you, because that also helps keep the cool and keeps things insulated. And then you definitely want to avoid exposure to heat or light. So hopefully, um, uh, you're not like like the short time that you have it out and you're drawing it up shouldn't be an issue. It's just you don't want it sitting on your counter for too long. All right. And another thing I want to touch upon over the summertime is traveling. How do we travel with our medications? So, some tips that I have here is it is definitely worth it to invest in a small insulated cooler if you don't have one already, and definitely travel with ice packs. The thing is, you want to make sure your ice packs are fully frozen before you leave, but you don't want to place the medication or your vials directly against that ice. You want to either wrap the ice pack in a separate, like put like a paper towel over it, or something like that, or a cloth so that it's not directly touching. Other than that, they could both live in the same cooler bag. If you are flying, and this goes for all medications, make sure you put it in your carry-on and not your checked luggage. We don't know what luggage control does with our suitcases. And it can get too hot in wherever they're storing it. So make sure you carry it on you. TSA, of course, allows you to bring your medications. I always recommend bringing some sort of, making sure that at least your prescription label is on it. So with your full legal name, make sure it matches with your ID. And if you want to even bring a doctor's note to be on the safe side, you can. But usually the prescription label with your name on it is suffices. If you are driving, make sure you don't leave it in a hot car, or like make sure it's not stuck in the bottom of your bag and you have it like tucked away in the trunk or anything like that. Keep it in an area that is pretty cool. Again, the cooler bags would be really, really helpful, especially if you are carrying ice packs. If it is a long trip and you're doing pit stops, you could even get like some ice from like the soda machines, put it in a Ziploc bag. If your ice packs are melting too quickly, that's an option too as you are making the pit stops along the way. Um, and yes, so again, another question that we get is with the needles, if you're able to travel with needles. Same thing with with your medications, as long as you're traveling with a medication that requires needles, they'll be fine with it, as well as your with a valid prescription label. Something that I advise is, instead of, it's definitely going to show up as it passes the X-ray. So make sure, if you have everything in a bag, it might even be worth it to kind of take that, your medicine pouch, out and show, like, put that in a separate bucket and have them examine it instead of going through your whole backpack or your carry-on. That's also something that you could do too. So put it with your laptops and all of that good stuff. And then, of course, once you get to your destination, you want to put it in the fridge as soon as possible, and it's just going to preserve the integrity of the medication. All right, so common issues and what to do. So, very common, you might notice redness or itching at the injection site, and that's usually due to histamine release. You are puncturing the skin, and that's going to cause irritation. Applying a cool compress on it could be really helpful in kind of keeping the redness and the itching down. Hopefully, you are familiar with some of the signs and symptoms of an allergic reaction. So, if it breaks out in hives, if your whole body is getting hot, if you are, having trouble breathing or anything like that, that goes beyond just the injection site kind of irritation. That could be a more systemic, like, allergic reaction. So you definitely want to seek medical attention. If that is the case, get a little bit of Benadryl, especially if it's like your first time using the medication. So sometimes you might also notice a lump at the site, and that could be due to that slow absorption of the medication. We really do recommend rotating the sites again so there's no pooling of the medication in one specific spot. Okay, so here are some of the frequently asked questions that we've been getting. So I'll do my best to kind of go over these with you guys. And if you guys have any more questions, definitely use that QR code so we could address it at the end. So the first one is, what if I see a bubble in the syringe? Really good question. So because we are doing subcutaneous injection, we aren't, too worried about a bubble being in the syringe versus something like IV, which that could be really problematic if you are injecting a bubble into a vein. So I do recommend that it's going to take a little bit of practice when you're drawing up your doses, but sometimes if you have a plunger, you have your dose, you could draw kind of like past what you need and then kind of go up and down until that bubble goes out. The other thing that we recommend is just lightly tapping. You could hear kind of, that's all I'm doing, tapping it at the site of the bubble until it pops as well. If there is a big bubble, I would recommend just redrawing the dose, kind of like push all the liquid back into the vial and drop another dose, because that bubble could kind of throw off the dose that you're getting, if that makes sense. Can I reuse needle? We do not recommend it. So these are just single use. Once you use it, make sure you dispose it in the sharps container that you have. What if I forgot to refrigerate it for a few hours? Again, I think it depends on the circumstances of where you left it. If you left it in your kitchen counter and your home is a comfortable, like 72 degrees, 70 degrees, it really is fine. Just put it back in. But before you do that, I would just kind of do an eye, like, visible check to see if there's any changes to the vial. Or you could just drop a little bit for your next dose just to make sure it's not cloudy. Nothing is like, there's no black spots, like nothing growing in there, because the refrigeration really helps prevent any bacteria or mold or anything like that from growing, as well as keeping the integrity of the medication. So if you see any changes, like visible changes to the medication, that's no good anymore. But if everything looks the same, looks good, just put it back into the fridge. And this is only the case for a few hours. So if you are going, like if it was overnight, call your pharmacy, ask them what you should do, because again, this could also differ from medication to medication. Some medications are much more sensitive outside the fridge. So, ask the pharmacy that you got the medication from. How do I know if I did it right? That's a good question. I mean, first of all, you would notice that, again, with sometimes some medications take some time um, for it to kick in, but you should notice the effects of your medication, whether it's over a couple of weeks, or if it's something like insulin, you should know that it's working pretty quickly. Um, if you I don't really know how to how to like kind of explain it otherwise, but if you are drawing up the medication in your syringe and after you inject it, the medication's not there, it's likely gone to the right place. And we really need it. As you can tell, the needle is not very long, and we don't need it to be very long to reach that subcutaneous space. So, if you have a little bit more kind of like fatty tissue, you could, just make sure that the whole needle goes in so that it's not visible before you start plunging. And that would make sure that the medication gets in there too. I hope that if you have any more specific questions, put it in the Q&A and I could try to answer it. Oh, here is can I store my compounded medication in a skincare fridge? What do you mean by a skincare fridge? I don't think I'm familiar with that, but as long as your fridge it's held at the same temperature as a normal fridge would, then that is completely fine. It sounds like you might keep like your skincare in a fridge that, obviously for your skincare products. So I would say as long as the temperature is is like the same range as we would in a conventional fridge, that is completely fine to store it there. Why should you inject at an angle? That's really just for a comfort thing. And I think it's also like where your hand is most comfortable. You could do it anywhere from a 45 to a 90 degree. That is completely fine. Some people say that 45-degree angle, it's easier for them to manipulate, and it's less painful, but that's really it. All you need it to do is to get into that subcutaneous, that fatty tissue space. A good question. How can we view the previous webinar? That's a good question. I believe it should be living in our Facebook group and our Reddit. If you want a link to it, I'm not sure if it's on YouTube, but we will repost it we'll kind of bump it in our Facebook group. If you have not joined our Facebook group yet, definitely join it. It's such a good community there. If I couldn't answer your question today, ask your question on that in that Facebook group, and we will get back to you as well. But really great community there. What do you think contributes to different results with different injection sites? I don't think that it does. I would say that the way you inject would probably be lower on the totem pole on how it affects how much you're like really absorbing. Now, with any medication, everyone is going to respond a little bit differently, whether it's how quickly it starts working, how quickly it starts accumulating in your body to reach like a steady state. But if you're asking, like, injecting in your thigh versus your abdomen, there really shouldn't be any major differences. Again, that subcutaneous space, that fatty tissue really kind of monitors how much medication gets absorbed into the bloodstream as well. So sometimes maybe if you hit a spot that does have a little bit more subcutaneous fatty tissue there, maybe that slows it down a little bit. But if you're talking about, between the thigh and the abdomen, there really shouldn't be any differences, unless you're experimenting it and you notice that when you're experimenting it on the thigh, you notice the effects kind of kick in faster than if you were to do it in the abdomen. That is definitely very individualized as well. I'm obese and can't fold my skin in order to inject. Any issues with that in terms of steady absorption within the body? It so blood vessels does still run through the the fatty tissue. The reason why we say to fold the skin is just for a comfort thing. It's the pinching of the skin kind of draws draws it away from the body a little bit, and like you're having pressure on it, so it draws away from the pain. If you can't pinch wherever you want to inject, just go ahead and 90-degree, 45-degree, any which way that you find it easiest to manipulate the needle, get it in that way. Can we drop the medication straight up? Yes, but leave the syringe out to bring to room temperature. Yes, that was the other tip that I forgot to mention. You do just want to make sure that when you're after you draw up your dose, when you're recapping, just to make sure that, well, first of all, make sure you do recap it so that the needle is not exposed, and make sure you are careful to not poke yourself as you're recapping that needle. But yes, that is definitely a very, very good idea. And again, make sure that if you do this and you're bringing it to room temperature, kind of keep a timer, and keep it away from children. I know I have a little toddler who's kind of tall enough to grab things off the counter now. So you just want to make sure you're putting this in a safe place after you do that. Great questions. Okay. Why can't you freeze the medication? Because we don't know what happens when you thaw it. The integrity of the medication, it's how it's kind of made in the vial and everything like that. It is essentially like your molecule of the medication is one way. If you're freezing it, you could be changing that molecule of the medication. Especially, once you freeze it, we know what happens when things thaw. Things are gonna be a little bit more watery, and that is gonna ultimately affect the integrity of your medication, especially if this was not meant to be frozen. Some medications are stored in the freezer. I know, like, even some vaccines are recommended to be stored in the freezer until we're ready to use it. But that's, how it's engineered. In this case, it is not. So please don't freeze the medication. Good question, though. How can I tell my medication is still safe to use in case it goes beyond a week or two after the BUD? So I would say that the BUD is what the FDA and the standard that compounding pharmacies are held to. Um, that we are required to put that beyond use date. Even with general medications or vitamins and supplements, typically that means that studies and research is done within that BUD. Now, best practices, I would say toss it, or I would say call your pharmacy and ask them for their advice. Every medication is different. Some really are like, don't go beyond this. But again, always do that visible check first. Sometimes it's not so much of a safety thing. Sometimes it could be that the medication starts degrading after that beyond use date. So best practice, call your pharmacy that you got it from and ask your pharmacist. They could, look at the medication specifically that you're getting, what the data says about that specific formulation, because the way the formula that it's made in can also alter the beyond use date. So talk to them and they would definitely guide you. Can you pre-fill syringes for use later, days or weeks later, not just hours? I don't recommend that just because for a lot of reasons. Like it it definitely could kind of affect how, like, the exposure risk of the medication. These aren't meant to be, I mean, I can't see like why not, as long as you're being really careful and putting it back in the bags. But I really do think that everything that's in your vial, the base that the medication is in, like all of that does help support the integrity of the medication, keep it from being the best that it can be, the integrity of the medication so that it works the best. So I would advise against doing that. But again, maybe if you want to call your pharmacy and ask them for your specific medication, then that is an option as well. I'm flying to Scotland. What would be the best way to take my meds? So, I would say bring a cooler bag and pack ice packs with you. Um, Make sure that you are wrapping that ice pack, whether in like paper towel or some cloth, so that your medication is not directly touching that ice pack. Keep it with you. I recommend a carry-on or your personal bag, and always make sure that your medication has your prescription label on it. So you want to make sure that your legal name is on the prescription label, matches your ID that you'll be showing, or your passport, so that TSA knows. Um, you're not going to have a problem getting through TSA typically with the medications. And then when you're in the air and you're on the airplane and you're noticing that your ice packs are kind of thawing out, or they're melting and they're not being cool anymore, ask your flight attendant for some ice. So you could bring extra Ziploc bags, like the heavy duty Ziploc bags. Bring extra one of those so that you could fill that with ice from your flight attendant, and that way you could keep it cool. In some cases, I don't know if the flights, I guess you can always ask them if they could store it in the fridge for you, but I would always recommend keeping it on you. You don't want somebody else handling your medications. So I would ask your flight attendant for ice, and keeping your medication cool that way. Definitely before you land, um, get fresh batch of ice, because we don't know how long it's going to take you to get through customs, and get back to your hotel. But just always keep an eye on your ice. If it's starting to melt or if it's warming up, then try to replenish and get some new ones. Empty. That's a good question. So, yeah, as I addressed before, they will allow you to bring the empty syringes with you as long as it's accompanied by your medication. I don't know if you're bringing empty syringes, if they'll have, like, just by itself, like what they would say. But if you like, just to err on the side of caution, ask your doctor for a doctor's note. But as long as you have medication to show with it that you need a syringe, they'll let you through with it. Yeah. I'm sure if you've checked like the bathroom sometimes, because these are the same needles that people use for insulin. So people have to carry their insulin, and they even have sharps containers in like the bathrooms where you could dispose of it safely there too. If I get queasy, is it okay to insert a little bit of the medications and stop and inject the rest? Yes, definitely. You can even do like half of it in one site and then half of it another site. I know that's going to be like two pokes for you, but yeah, you could kind of, that goes along with that whole plunging slowly. So if you want to give yourself half the dose, kind of give yourself a minute and then do the rest, definitely appropriate. Really good question. How do I get the last of my medication from the vial with my syringe, the very last drop? That's going to take practice and technique. But what I usually do is make sure that you kind of like making sure that if it's sitting, I'll pull it up. If the medication is kind of like sitting at the pool or like at a neck over here, you want to kind of like make sure everything is on the bottom. And then the technique is just going to be going back and forth with the plunger, and over time, you'll get good at this, is that like you could pull the needle out so that the whole needle is not inserted in. You're gonna have to pull the needle down a little bit. So maybe half of the needle is in past the rubber stopper, and then you could draw up whatever is on the bottom. Because if the whole needle is in, we're not gonna be catching anything that falls below the tip, if that makes sense. So slowly kind of practice pulling it out so that half of the needle is in, and then drawing out the remaining. And if you can't get the last of that like, these medications or like anything will have a little bit of overfill for you, so that you can make a mistake here and there, but you don't. If you are needing that last drop, talk to your pharmacy and see if you could get a little bit more, or like have them or ask them why you tend to be running out, if you are running out. Can you briefly discuss the measurement lines on the syringe? Yes, absolutely. Okay. So, um, this is again, like I mentioned before, is a insulin syringe. So this whole thing here, as you can tell, it is a 1 milliliter syringe, and the markings on it are actually all in units to make it easier for our diabetic patients who need to use insulin, because insulin is measured in units. So if you think about it, if this whole thing is 1 milliliter, and there are 10 equal kind of sections or markings on it, if we do 10 units, that is 1/10 of a milliliter, and that is 0.1 ml. If that makes sense. I wish I had like a drawing board. I think we'll get that next time if we need it. If maybe we have another webinar, if you have questions more on like what that dosing looks like for you. But let's say your dose is half a mil, then technically you would be going to that 50 units mark, because it is half of that milliliter syringe. I hope that makes sense. If your dose is 0.6 mils, then it would be 60. It would be at that 60 units line, because it is, like 0.1, 0.2, 0.3, 0.4, 0.5, 0.6 of an ml, because the whole thing is 1 ml. Good question. Why do I have to discard what's left in month 1 when moving to month 2? So I think that is a very specific question to your medication that I might defer. You ask the pharmacy that you are getting the medication from specifically, but we always recommend discarding the rest, because it either comes down to that beyond use state. If month 2 is a different strength of the medication, different dose that you're doing, then that could also play a factor as well. But very different from medication to medication. So I'll probably have to defer you to the pharmacy that you were getting it from. Again, everyone's like regimen on your medication could be completely different. Everyone's doses is different. Can you further clarify the thigh location for injecting? I heard it needs to be on the outer thigh. Does it matter where on the thigh? I would say, I don't know about you, but my inner thigh is definitely more sensitive than my outer thigh. So if I am injecting anywhere on my thigh, I would definitely do the outer, kind of like outside of the thigh. That's going to be less painful than the inside. The inside of the thigh is actually a little bit more vascular as well, and the skin is a little bit more thin. So that is where you're going to get a little bit more irritation doing it on the inside of the thigh, but I would say anywhere like on like the front or the outer part of your thigh are really good spots for subcutaneous injection. What happens if you accidentally inject the medication into a vein? Are there negative impacts? Your syringes, it doesn't go deep enough to reach a vein unless you're like intentionally doing that in, like where you would normally be doing that. But the length of your needle, if you are injecting at the sites that we recommended, you're not going to get it into a vein just because it's not going to reach. And that's why we have those sites for you, or that we recommend for injection. I had skin removal and don't have a belly button. Can I inject directly where it would have been? Like where your belly button would have been, I would say if you don't have a belly button, don't I would avoid that whole area then and maybe do it off to the side, because we're doing 2 inches away from like where the belly button would be. So I would say kind of um if you don't have to inject directly in the middle of your belly, I would focus on like the side in the area. Um because I'm not too sure like what happens when you have that skin removed, like what's behind that skin that they like keep, like if they took out that whole piece, and technically the whole thing is subcutaneous, so that should be fine. But again, I would just kind of focus on the outer areas or like the side of the abdomen. I haven't received my package yet, so I don't know how long the needle is. Do you insert the whole needle? I could show it to you here real quick, and it's really thin and short. It's like less than an inch long, maybe like a centimeter. And it would be I would recommend it just to make sure that like you're getting it subcutaneously. If if you have good control, you don't have to put the whole needle in. You could just do like halfway in and inject it that way. But you do also want to make sure. So if your skin, I think that's another piece. If your skin is a little bit thicker, then I would definitely inject it all the way through. But for the norm, like for anyone, for the general population, I would say you could do either halfway through. I wouldn't just do like the tip of the needle, just because that might live more in like the surface, the epidermis of your skin. That's not our intended place for injection. So you want to get it at least halfway in, um, and or all the way in, because it's not a very long needle at all. But good question. Do I need to shake the vial before I draw it up, or would that cause bubbles? That technically can cause bubbles. I wouldn't, like with these medications, are just, injecting medications. We never really tell people to like shake it up. We do recommend you kind of moving it back and forth with injectables in these little vials, and that should be enough to kind of mix it up if anything, if it needs to be mixed up. Is it okay to break my weekly dose into 2 separate ones? I get queasy when I get my full dose. Can I do again, that is a good question for your doctor. Yeah, I wouldn't even say ask your pharmacy. I would say ask your doctor this question. With there can be lots of dosing schedules and regimens for different medications out there. So for this specific questions, I would have you ask your doctor directly, or your provider, and see what they think. And I don't see why not sometimes, but again, it also comes down to the medication, how it reaches steady state in the body, which also differs from medication to medication, but that is a question for your provider. Is the original cap on the vial reusable? I don't think so. Like once you pop it on, I mean, you could try to pop it back on, but you don't need to. And that's why we recommend using that alcohol swab to wipe it before each time you use it. So every time that you take it out of the fridge and you're prepping it for a dose, you want to make sure you use an alcohol swipe to wipe it. But that's a good question. Okay. I think that was all the questions that I had. So thank you so much for all those questions. I hope you asking the question is definitely going to help the people in our community because I am sure that they have the same questions. So thank you for interacting with us and asking these questions. So, final reminders is that it takes practice. It takes practice not just to draw up the medication, it takes practice into like hyping yourself up to inject yourself. But you got this. Your community is there. If you are not in our Facebook group already, you can always reach out to ask the question there, and we'll definitely be there to help you answer. Please reach out to your Telegram provider as well or any qualified pharmacy that fills your medication. They would also be a really good resource because if you are having issue, just bring it in, bring it in and be like, hey, can you help show me? Or like if they want to do a video and like walk you through it. But yeah, contact them via the clinical chat or your patient dashboard. Those would be your best places. And that is it for me today. Thank you so much. I thank you all again for showing up to this webinar. It was a lot of fun. If you guys have any other topics that you want to talk about, please let our community know. We are listening to you guys and we are doing these webinars because of what you guys request. So just let me know. All right. Well, thank you so much. I hope you guys have a fantastic day.